name is Caitlin Ryan, and I am the Interim Executive Director here at the Cannabis Alliance, where we are dedicated to the advancement of a vital, ethical, and sustainable cannabis industry. I am really excited for our speaker today, and we will be doing a replay on 420 because we want to make sure that on 420, as we're celebrating our industry, we are celebrating what is most important, and that is all of the advocacy that patients have done over the years to get us to where we are right now, and we want to make sure we don't lose that focus. So I would like to introduce Jessica Pichardo. She is a board member here at the Cannabis Alliance. She is co-chair of the Equity and Justice Committee, as well as founder of Canaloose, and is operations manager for Dockside Cannabis. Jessica, thank you so much for moderating today, and I'll let you take it from here.
Thank you, Caitlin. I appreciate it. Hello, everyone, and thank you for joining us. These conversations are always such a treat, and today is no exception. I am very, very excited to connect today with Imani Barbarin. She is an advocate, disabled rights advocate, and is joining us today, I believe, from Pennsylvania. So thank you so much for making the time and space to join us, Imani.
Thank you all so much for having me. Thank you.
So today we're going to give Imani the floor to do a talk for us, and then we'll have a moderated discussion to follow. Thank you all for joining us on Facebook Live and also on Zoom today. Imani, I'll let you take the floor if you want to do an introduction.
Hello, thank you everyone for inviting me here. I am greatly appreciative of you asking me to be a part of your advocacy today. As discussed, my name is Imani Barbarin. I'm a disability rights and inclusion activist, and I often write from the perspective of a disabled Black woman. I love talking about the disability community because I think it is so vital to understand the disability community's perspective in all things, as well as understanding just how influential disability is in every single one of our lives. Disability is something that can happen to any one of us, whether from birth, from injury, from aging, all of those things. We are all susceptible to disability. And so understanding the ways in which disability can be manipulated, can be used to keep us apart, to keep us out of community with one another is incredibly important. Now, globally, about 15% of the population has a disability. In the United States, that's about 25% of the population. So it's an incredibly high number of disabled people. And the people most likely to become disabled are Black and Indigenous people. When I talk about intersectionality and inclusivity, we must understand that racism, bigotry, and othering in and of itself is disabling. And is meant to be disabling, keeping people out of the public sphere so that they are erased and their existence pushed aside is the entire point. Everything from medical, systemic to environmental racism is meant to disable populations that the United States or majority cultures do not deem worthy of having the resources to survive. So understanding that is important. Now, as we talk about cannabis, cannabis, as we all know, has been used as a tool quite effectively to keep Black and Brown people out of society, to imprison, to put them within the school to prison pipeline. We starve them of resources first, and then we criminalize them once they figure out a way, utilizing cannabis to help their neighborhoods, to help their communities. And disability is incredibly crucial to that school to prison pipeline, to that, the prison industrial complex. About 30 to 40% of people in jails and prisons have a disability. And then when you couple that with the knowledge of what I just said, that 25 to 30% of Black and Indigenous folks have a disability, it starts to paint a very stark picture, right? About how our system manipulates and starves people of resources that could help them. Then once they utilize the help that is now criminalized, they're now imprisoned and kept out of society. Disability is the key to everything. And I mean that with my whole heart. Disability, understanding disability and understanding ableism is our key to everything. The disability community is incredibly diverse, but you would not know that judging by how we are represented. Often, disabled people are presented as white men whose greatest flaw is that they have fallen from the great heights of white privilege to which they are entitled. And so whenever somebody who is presented as Black or brown having a disability, it's, oh, well, that's expected. They don't take care of their own. They don't help their own. They don't know what they're doing. They're more diseased than everybody else. They are more likely to have pre-existing conditions that they've passed on genetically to everybody else. But no, that's not necessarily the case. The fact is, again, we starve communities of resources. We starve them of medical care. We starve them of financial resources and good food and fresh food. And then we criminalize them for asking for help. We criminalize them for taking those resources that the land gives us. The land is actually saying, here are some medicines that we have for you. Like, we're going to criminalize you for utilizing those. When it comes to disability, we must understand this. We must understand the way the system is manipulated. And it sounds so grand, right? It sounds so very much so conspiracy theory, right? But we watch it play out every single day, do we not? We watch as people are thrown into prison for things that now the white majority is now profiting off of. Because let's not forget, the dispensaries, the farming, the consumerism of cannabis is now decriminalized in some states while people rot in prison for what the white majority is now profiting from. When we seek decriminalization, when we seek destigmatizing cannabis, we must also call for the getting people out of jails and prisons for drug offenses. We need to be decriminalizing all drugs, and we be investing more in harm reduction than in this fake idea of rehabilitation utilizing the criminal justice system. Because it doesn't work, it has never worked. It has only been used as a tool to erase and eradicate. I am very much so experienced with cannabis. That's what I'll say. Because if my mother ever finds this video, I will never hear the end of it. But I am somebody who's very experienced with it, and it has helped me with my disability. I am somebody who experiences pain on the daily. I have spastic diplegic cerebral palsy, meaning that I have cerebral palsy from the waist down. My muscles spasm, they tighten, and they're incredibly painful. It's painful to walk every day. Sometimes it's painful to sit down. My legs always feel like they're under strain. That is the general feeling of them. And in utilizing cannabis and CBD and all these different products, my legs feel much better. I feel like I can go farther, but I'm still scared about the stigmatization of me, a Black woman, taking part in something that has criminalized and imprisoned so many of my Black peers, especially my Black femme peers. When we see the disability community sees cannabis as very much so part of our ability to address disability holistically. I think that it is important that we investigate cannabis's effects on disabilities and the ways that we could live our lives out fully. But I do want to caution you with a warning. As great as it is, we cannot present it as the end-all be-all of cures for disabled folks. It needs to be a part of the solution, not the entire solution. Oftentimes when I'm advocating with other disabled folks, we'll find somebody in our comments or in our lives saying, well, cannabis will get rid of all this for you. You know, you won't even feel disabled. Oh, Lord, it's tiring. Because of course I'm gonna feel disabled. I walk on crutches. There's no amount of cannabis that's gonna make me feel like I'm not walking on a boat without any sort of railing next to me. That's how I feel all the time. But we must unpack our desire to see one or two things as the end all be all, as a cure, as a panacea for disability. I think this comes from an attitude around disability that it is an individual problem, right? We as a society build policy around disability through the individual model of disability. Now, a little backtracking, okay? There are several different models of disability through which society decides they want to address the issue, right? There's the individual model, there's the social model, medical, charitable, all of these different models. But essentially, the United States thinks your disability is an individual issue. Excuse me, my laundry. Your disability is an individual issue. Your disability is an individual issue to be addressed by you. We're not going to spend any money on you because this is your issue. This is your problem. You have to be cured by you. We're not going to address it. We're not going to spend money on that. We're not going to make things more accessible. This is on you. I have nothing to do with your disability. I have nothing to do with making sure you overcome your disability. And addressing disability and cannabis in that way is the same thing. Presenting cannabis as a panacea says, well, this is the one thing. And if you don't do that, then you're wanting these symptoms to continue. You're wanting for your life to be more difficult when it doesn't have to be. But we need to start addressing disability on the social model. The social model of disability says disability is one thing. Medically, disability is one thing. But the way society is built to disable us further, that's a completely other thing. We cannot blame people for not overcoming inaccessibility that we have not addressed throughout our society. There's a disability advocate who has since passed named Stella Young that says that there's no amount of smiling I can do that could turn a set of stairs into a ramp. There's no amount of overcoming my disability that I can do that will turn a set of stairs into a ramp. But we all look at disabled people and say, you're not trying hard enough. You're not doing enough. We must address disability holistically and say that we can all come together and with the resources that we have to create a society that is built for everybody. When I think about what liberation feels like, and when people ask me what I see for the future, I usually don't have an answer, right? One of the things that oppressive systems rob us of is the ability to imagine a world without them. That's the first thing. So whenever we create these new fantasies of what the world could look like, or these new ideas, we're basically jockeying for whose idea looks the best to us. When in reality, we're sometimes creating carceral systems that replicate the oppression from which we came. When I think of a world that is inclusive and kind and generous, I don't know what it'll look like, but I know exactly what it'll feel like. And I know what freedom feels like. So I can continue to chase that goal as we dismantle white supremacy, as we dismantle ableism, racism, and other forms of bigotry. I want to live in a world where I don't feel as though one mistake, I want to live in a world in which one mistake does not wreck my entire life. Where the idea that me utilizing medicines that the government does not approve of does not mean that I lose my entire life and the people around me. I want a system that doesn't punish people for existing in Black and brown bodies while profiting off those same bodies in the same breath. I want to live in a world where I could feel spontaneity and joy and feel like there's balance around me. I don't know what freedom looks like. I don't know what dismantling the system would look like, but I know what it'll feel like. And we should all be chasing that feeling, that high of being free in this society. And it starts with disability. It starts with including disabled people in every conversation that you have. Whenever I talk about disability, people do not understand just how far-reaching it is. I was talking to Caitlin about this before I started this talk because I love talking about disability and I will not shut up about it. But for those who don't know, disability is in part of the reason why we do not have a higher minimum wage. In 38 states, it is legal to pay disabled people below the minimum wage. And each time that they propose to increase the minimum wage, they package ending some minimum wage for disabled people with a rise in the minimum wage, right? And so for disabled people, if you make too much money, you'll lose your health care. You could lose your home. You could lose your services. You could lose your benefits. You could lose everything for making too much money. And politicians know this. So they package those laws together. And then they ask parents of disabled people, would you like for your child to lose their benefits? Would you like to have to pay out of pocket for all these services? Because that's what's going to happen if we increase the minimum wage and disabled people can make more. That's exactly what's going to happen, right? So there are lobbying groups dedicated to keeping the minimum wage where it is, so the disabled people can continue to live. But if you did not know that, you're only addressing part of the problem. You're only addressing the part of the problem that does not involve disabled people, which is we need a $15 minimum wage, we need a $22 minimum wage, what have you. You're only addressing this one specific part, not realizing how disability is being used to manipulate us all. We must include disability in every conversation, in everything that we do. That includes cannabis, that includes decriminalization, that includes prison abolition, because everybody here should be also fighting for prison abolition. Because if we are here to benefit from from cannabinoids, from having these tools at our disposal, we should also be making sure that people are not being punished for what we now benefit from. We must include everybody in this conversation. And the way that disability is utilized is the key. Thank you.
Thank you, Imani. If I could sound applause. Yeah, I see some folks acknowledging. That was extremely powerful. Thank you very much for kicking us off today in ways that I think have created lots of brain paths for us to go off of. So thank you very, very much. I wanted to discuss and just let's start backwards with what you were just discussing about minimum wage and disability. Through your videos, I've learned that disabled people, it costs 30% more in order to carry the same quality of life as non-disabled people. How do we go about that, right? As if you discuss making too much can remove services and different things that you have access to. Where do we go? This is, as you know, Rem mentioned, a racism and oppressive issue. How can we, in the more like the community, local community, create some impact, or how can we advocate? Where would we start?
Yeah, so I think one of the things we need to address first is our access to healthcare. Part of the reason why we spend 30% more is because we're actually spending for accessibility. We're spending so that we have access to the exact same things. And we had to buy our own accessibility. We also have to argue with doctors about what we actually need versus what we don't. And to be quite honest, we need to overhaul everything all the time because there are way too many people between disabled people or medically compromised people and their medical professionals. We have healthcare, we have health insurers, we have employers, we have politicians. Between everybody who doesn't need to be a part of the equation needs to go. So we really need to address healthcare. We also need to address the cost of healthcare. There is no reason why insulin should be upwards of $2,000 a vial. There's no reason for that to happen at all. There's no reason why big pharmaceutical companies are making billions upon billions upon billions upon in the United States almost exclusively because these prices are not occurring elsewhere. And we need to decouple our health from capitalism. There's no reason for us to have a dollar value based on how much it takes for us to stay alive. And I get so frustrated thinking about it every single time, because if they could charge us to breathe, they would. And where does it stop? Where does it end? And Medicare for all is good. I think Medicaid for all would be better. A lot of people love Medicare, but I think there's a lot of stipulations with Medicare that Medicaid does not often have to deal with. But everything needs to happen at the same time, because people always propose universal basic income as a solution automatically without ever addressing that disabled people's benefits are income based. So like you're giving us more income, but if we lose our healthcare, it's actually less income. So people need to understand like a lot of these systems go hand in hand and build upon one another.
Absolutely. You discussed healthcare workers, and I want to discuss a little bit about that. You've noted before that healthcare workers don't recognize the power that they have in their record keeping, and how that can long-term, short-term affect disabled persons' access to, again, their services and to all of the things that they have access to. Can you discuss that a little bit about that superpower, and maybe lean into, again, how holistically we would work with something like that, cannabis advocates, right? Working with traditional Western healthcare.
Yeah, so what I had said, I think it was in that video that I did, in which I said that healthcare workers have a lot more power over a disabled person's life than they realize. What a healthcare worker writes down on your chart could even impact your ability to vote in certain states. If you're are put in a conservatorship or a guardianship, in certain states, you're no longer allowed to vote. You're no longer allowed to have certain autonomies as a member of society. And a lot of people do not realize that. So I think what healthcare workers need to understand is disability rights and disability law. I'm not even talking about disability justice at this point. We should be all striving for disability justice. I would just settle for them to know the law and know what they are required to do. But a lot of times there's so much resistance because people don't really think of us as citizens. People don't really think of us having public lives. So I think advocating for healthcare workers to educate themselves, to understand that they too are fallible, and to be humble enough to know what they don't know, and defer to disability rights attorneys or advocates in those cases. Additionally, I would hope that that medical professionals do not pass judgment on what disabled people or chronically ill people want written down or want in their charts, or the treatments that they want to have access to. Because there's so much judgment based off of society's perception of different medications, different treatment processes. And it needs to go, it really needs to go. So helping advocate for those things would be extremely beneficial to our community.
Mm-hmm. And you're talking now about, different medications and different medical or health plan pathways that, disabled people walk or journey through. Cannabis, can be helpful. CBD can be helpful. By no means a cure-all. I think you're in the right room. We do not agree on that. That's such a hard place to, even bring up, I think, the medical option of cannabis in, is that something that you've ever run into, or that you have any anecdotal, anything to share?
I think there's a big fear because, especially for Black and Brown folks, there is this perception that if you're going to a doctor, if you're going to a medical emergency situation, they see you as drug seeking to begin with. And for a lot of Black and Brown people, asking for cannabis or asking for any sort of pain relief can get us thrown in jail, or can get us, kicked out of the hospital, or can get us have the police called on us. And so I have never even thought about asking my medical professionals, can I have access to this? Can I try medical marijuana? Can I try all of these different products? Because there is still that fear of, I don't want to get the cops called on me. I want to still be able to see my doctor. And so understanding how race plays a role in how people seek medical care is crucial. And that includes in cannabis discussions, because there are a lot of people that don't understand those nuances and just kind of want to bluster through, and not all of us have that privilege.
Absolutely. And you discussed earlier in your conversation about white supremacy and accessibility, even in the, in legal now cannabis spaces. I work for a company that is women and minority owned, but it took 10 years in this business to find a boss that reflected that. And so, that is very true in our circles as well. I want to just tiptoe back to a little bit about the societal model versus the medical model for disabled persons. I thought that was really impactful, and perhaps we can talk about that some more.
Yeah, so the medical model, I see, so I see the models of disability as two separate ones, which is the individual with several subsets, and the social model, which is its own thing. But underneath the individual model, I see the medical model. So the medical model basically says disability can be cured, or disability can be addressed through medical intervention alone. So surgeries, therapies, and a lot of times, a lot of people take that as with or without the consent of the disabled person, because they quote unquote know what's best. And that's very disturbing in a lot of ways, in which we also need to address that too. But the medical model is very much under the guise of, we could cure this just as long as people consent to the right medical interventions. That's not always going to be true. You can't, there's no 100% cure for anything. I mean, and there's also an issue too, where especially parents of disabled kids, because they're looking for guidance, they'll often interact with other parents, and that can lead to very dangerous things like experimentations, therapies that are considered torture by the adults that have gone through them. I was locked in a hyperbaric chamber and spun around as a child, because people told my parents that this therapy would repair the part of my brain that is partially dead. Like, there's all these little things that can follow, that disabled parents and families can fall into, utilizing the medical model. Now, the social model says we need to build a more inclusive society. And I don't think the social model looks at disability and says, oh, it's solely society that makes people disabled. But we often do contribute to disabling folks by not building a inclusive society. Like we don't prioritize accessible infrastructure. I don't know if you've seen this viral photo of a library where they put ramps in between the bookcases on this incline, and they were like, oh, this is so accessible, this is amazing. And disabled people who actually use wheelchairs were like, this is dangerous, like I could fall off this thing. People always ascribe accessibility to us without actually talking to us, without actually asking us what we actually need. My biggest pet peeve are wheelchairs that climb stairs. Who asked for that? Nobody asked for that. You're building a $40,000 wheelchair that can climb stairs for one person, when a $4,000 ramp would serve every single person that encounters that obstacle. We need to stop thinking about disability as an individual issue and start thinking about how we as communities can address inaccessibility.
You discussed parents of disabled children, and disability comes in all ages, and so anything to offer in just with that. I mean, you had discussed a little bit about how your upbringing, you were taught very early that this is again, part of, I call it a superpower. My nephew has cerebral palsy, and that's the way that I talk about it. But could you talk a little bit about more about children with disabilities and what that looks like?
Yeah, so I appreciate that you call your nephew's disability a superpower, but I would actually encourage you to not do that.
Okay.
Just call it a disability.
Learning, yeah.
Because there's no shame in it. Like, there's no shame in me having a disability at all. And I think a lot of times we utilize flowery language to make disabled people feel better, but I don't feel any better. You feel better. Like, you feel better about talking about my disability. I don't feel any shame about it. I don't feel any hangups about it. And I'll be the first to admit it took a long time for me to get to this place. But again, I'm really excited to be here and to look upon disabled young people and kids who are like, I'm cool, I'm disabled, I got my crutches, they're decked out, I have a license plate on my walker, all these little things. Your disability is not in and of itself shameful. I think the way we treat disabled folks is shameful. The way that we exclude disabled people is shameful. But I should never be addressed in such a way that that I feel like I'm less than, or feel like somebody's trying to put me full of clouds and sunshine in order to talk about my disability. And I think the very first thing people need to do to unpack their ableism is to really see how they address themselves. Like, I'm very much of the mindset that how you treat yourself as it relates to disability and ableism is how you will treat other people. And it sounds very selfish. It sounds very like, well, why would I start with myself? There's so many other issues external to me. I could tell you why immediately. A lot of people are performing value and productivity for the gaze of other people and not taking care of themselves. They're doing so much to be seen as valuable because disability is so discounting and so isolating and alienating that they want to be seen as working, as productive, as valuable at all times. What do you do every single day that is not necessary? Like, where are you going through the motions on certain things simply to look like you're just pushing peas around on a plate to look like you're doing something? You don't always have to be productive. You don't always have to be up and running. I did a video once where a woman finally figured out that she could sit down while doing the dishes. Like, this was a revolutionary thing to her. And I was like, well, yeah, why not? Like, but people do things even in their own privacy, even completely alone, because that's just the way they've always done them, because that's what it looks like to be busy, to look productive, to look like you are doing something and have value. But what do you do every single day that it's not necessary? How often do you do or not take rest? How do you punish yourself for taking rest? The biggest giveaway is how people will call other people lazy for the rest that they need. Looking at people just sitting down, like minding their business. Oh, they're lazy. I work 16-hour days. I work 20-hour days. Well, if I can do that without any rest, why are they sitting down lazy? They're sitting down minding their business. Why are you not doing that? So how you treat yourself, how you address yourself is going to be how you address your advocacy as it pertains to disability.
Imani, thank you for the learning. And I think that there's levels of unpacking ableism, and I'm at the beginning. So thank you for the language learning there. Is there any other, besides language and, I get creating structural changes in our community? What are other, ways that we can unpack ableism, altogether?
Yeah, ableism and racism often go hand in hand. So unpacking how you see race through the lens of disability is also incredibly important. A lot of the ways, okay, this sounds weird, but a lot of the ways you'll hear just racism described or racism expressed sounds a lot like ableist dog whistles if you actually listen closely enough. Talking about how Black people are always angry and always violent and belligerent, that's behavioral health issues. Talking about how Black women are, so how do I put this? I'm trying to figure out the most succinct way of saying this, but saying how Black women are unintelligent and talk with gibberish and all these things. They're basically pointing to intellectual disabilities. So all of our racism goes hand in hand with ableism in some way. And so unpacking and decoupling those things and understanding the history of disability is incredibly important. Most of our perceptions of disability center around capitalism and started around the Industrial Revolution. And so it is very much so based in that, but also ugly laws used to exist. So between, I want to say 1860s, I think, between the 1860s and 1974, it was illegal for disabled people to be in public because it disturbed non-disabled people. We quite literally do not see disabled people in public spaces for much of the United States history. So just calling for disabled people to be considered in different conversations is a huge deal. Just demanding what is the perspective of the disability community on this issue is important.
Let's go farther into disability history. That's not taught. That's not something that I ever remember learning. As a youngster. Where does this fit? Does this fit in school education? Does it fit in all the places? Really? I mean, where do we go with that?
We definitely need to be talking about disability perspective in literally everything. I call for that all the time. Children should know about disability history. Adults should be studying disability history. Disability history happens often alongside other social movements. The Black Panther Party was supporting disability advocates for the 504 sit-ins at the same time that the civil unrest in the 1960s and 70s were also happening. It didn't happen like we as a society, we as Americans specifically, see we see histories as parallels, never meeting, never intersecting, never really hitting one another, but they all happen all at the same time. It's more of a braid than a parallel, right? We're all interwoven. All of these movements are interwoven. So making sure that we see the disability history in all of this is important. Like, for instance, broken windows policing, right? Started around the 60s, 70s. At the exact same time, there was a report by Geraldo Rivera accounting the experiences of disabled people in institutions, which was so horrific that the United States, within a couple of months, started a disability rights agency for disabled people to protect us against abuse and neglect. At the same time, they all started closing institutions and centers for disabled people. Now, this is a good thing, but they never really prepared society to actually interact with disabled people. So disabled people were flooding communities that were not prepared to have them. So we were being criminalized. People were getting the cops called on them. Because if you don't think about disability first, you'll think, oh, drunk, intoxicated, belligerent. So all these things happen at the exact same time, leading to where we are right now, which is a moment in history where disabled people are saying, I will no longer be forgotten. I'm not going to be overlooked any longer. But yeah, it needs to be taught everywhere.
Yeah, and it all everywhere makes sense. One of the things that you've discussed is, when it comes to police violence, a lot of those folks who are at the hands of police violence are having, an actual like episodic moment, or they're having, or they're disabled, and that leads to violence as well. Is there anything that you want to share about what we need to do in that lane of the world?
Yeah, we need to be investing more in our community. So about 30 to 50% of people killed by police have a disability. And what's the biggest, I think the biggest, I don't know, like, I guess discount of our society or damnation about our society is that our prison system is our greatest mental health system in the country. Like, that is where you get the most mental health care, is in prison, is in jails. And that's absurd. I also think about suicide prevention the same way I think about policing. And I don't see the point in suicide prevention if we're not going to discuss suicide prevention in terms of making sure people have resources, food on their table, have money in their wallets, have a roof over their heads, have access to transportation and community spaces and families, fresh food and vegetables. We always talk about it at the moment of the incident itself and never understand what leads up to it. And we pretend like this came out of nowhere. And I think about that the same way we talk about accessibility. We starve people of resources and then we don't give them the medical health care, the mental health care. We make till people get so desperate and then be like, oh, they were violent in this moment. What was violent before that moment? There was violence before that moment. Just because you see a physical interaction of violence does not mean violence has not been their history. It doesn't mean that they have not been the victim of violence throughout their entire lives. We need to rethink the way we see violence itself. The slap, quote unquote, is like a perfect example of that taking place. Watching people get angry over one physical interaction while watching as other issues get ignored on a daily basis, and say to people, well, violence is never the answer. Violence was the question. Violence was the question. Violence had led up to this moment. So we really need to rethink what we see as violence and really address that people are trying to survive these violent systems that they should not have to be surviving, that we should be actually building in prevention for these moments to never take place. And then defunding the police or abolishing the police, because why do they have military level gear to cruise down Route 30, like Route 30 in Pennsylvania? Like, what are they doing? What are they doing with this level of equipment? Why was the United States police forces giving military equipment to Ukrainians? Why do they even have excess amount of equipment enough to give to Ukrainians? I'm sorry, all that tangent to say.
And Imani, this next point might take us even further down just the frustration line. And that is, you talk about renaming what violence is. And I'm going to talk about the pandemic and COVID.
Yeah.
And you know how not wearing your mask and things like that is considered violence to the disabled community. I would consider, you know, we're endangering lives, and it's been a long 2 years with a lot of learning. And so as we learn more about long COVID and all these things, you know, maybe trying to steer away from the pandemic a little bit, what should we be paying attention to in policy moving forward, you know, when addressing that sort of community violence, I would say.
Yeah, so it's just been, can I say shit show? It's been a shit show. I mean, disabled people were really left for dead. And I think the most upsetting thing is, like, just as they were leaving us for dead, they made everything accessible for non-disabled people. People were able to work from home, people were able to have telemedicine, people were able to have community events, but disabled people were really just left in the dust through most of it. And I do see the people not wearing a mask and not getting vaccinated if they can as violence. I get filled with rage every single day. There's like a part of me that is gone now that I can never really recover, because at the same time that non-disabled people were pissed that they couldn't go to Coachella or you know, whatever music festival flavor of the week there was, disabled people were reading over medical rationing guidelines and said that they wouldn't save us if a hospital was at capacity and they needed to ration resources. I've heard audio of doctors saying to disabled patients, I'm not going to spend resources on you, you're not worth saving. There's other people down the hall that have a better chance of an actual quality of life. And all the while, people are like, well, I don't want to wear a mask because I don't like it on my face. Like, disabled people are literally staring down the barrel of this societal gun, and people are upset because they can't party. Like, but going forward, like, it's going to be everybody's problem. I think 1/3 of people who have COVID experience long-term disability, whether symptomatic or not. But every single person that will have ever had COVID is now going to be difficult to insure, because we don't know the long-term effects of COVID. We don't know what it's going to look like 5 years, 10 years, 15 years down the road. And a lot of people just kind of, it's going to be a very fuck around and find out moment, because these insurance companies are looking for ways to challenge disability laws because they're one of the few things that are keeping everybody insured. And everybody having access to remote work and accommodations, regardless of whether the people consider themselves disabled or not in that moment. So the future is very uncertain, and I would pay attention to disability laws because they are coming for them. There's already been like 3 or 4 challenges in the last 2-3 years. So, and
that has been at the federal level that you're
yeah, Supreme Court, like LA Community College, I think LACCD challenged that if discrimination is unintentional, it's not discrimination, which would weaken the entirety of the ADA. And CVS had the exact same. CVS is our largest healthcare company in the country. They had the exact same argument with healthcare. Like, if you're not, that if discrimination is not intentional, then it's not actually discrimination and cannot be criminally punished. Which would again weaken disability laws, which is good news for an insurance company who have to give everybody access to medical services. So people need to pay attention.
And it's a mess. I can understand the frustration. It's a mess. All right, I'm just checking to see if we have any questions coming in, Imani, from our group and on Facebook. I am not seeing anything now, but I'm sure they'll start to populate. We are coming up close to time. So I just want to acknowledge and give you the floor if there's anything else that you'd like to share with our group. It's been a true treat discussing this with you today.
Well, thank you all for having me. I do greatly appreciate it. I would just pay attention to what the CDC is doing. I've been getting people contacting me saying that the CDC has every intention of blaming the chronically ill and disabled for the high death rate, saying that we needed to have taken care of our healthcare beforehand and take all these different. And as somebody who's a communication professional, like, I could see down the road about how that's going to impact our access to healthcare, as well as people's ability to sue and hold accountable the companies that have for the last few years endangered their lives. So pay attention to that type of rhetoric. The United States government the CDC dropped the ball. They did. Not only did they drop the ball, they did it like so intentionally. It's almost laughable to think that it was an accident. But like I said, address your internalized ableism, address the way you see yourself, and that will greatly impact the way that you address other people. If you give yourself more forgiveness, if you give yourself more kindness, you'll be better equipped to extend that to other people. And that is incredibly crucial to whatever advocacy that you were doing.
Thank you, Imani. We have a bunch of thanks coming in on the chat for you. So thank you so much for being here today. All right. I think that is all the questions that we had today. I want to thank everyone for being here with us. We will be doing a replay of this conversation next Wednesday on 4/20. So be sure to tune in if you missed anything. I'll kick it back over to Caitlin if there's more questions, and so we can close today.
Yeah, thank you very much, Jess. There were a couple of other ones, I think, in here. One was around incarceration, and if there's a way, we had talked, I think, a little bit earlier about some of the rates of disabled folks who are incarcerated, and that is also one of our big focuses here at the Cannabis Alliance, because of the large number of folks who are still incarcerated due to even simple small cannabis possession. Is there a way to be more focused by including that intersectionality of race and disability as we advocate for our incarcerated folks?
Yeah, so I think, so in terms of access for disabled folks in jails and prisons, like I said, 30 to 40% of people in jails and prisons have a disability. When it comes to incarceration, a lot of times disabled people do not have the access to accommodations, or it's very difficult to get. You can always speak with protection advocacy agencies. Like I said, there's one in every single state. If you go on ndrn.org, a lot of them do prison work. A lot of them do advocacy for prisoners, and they may be able to help in those situations. One of the things that that I've seen a lot of is trouble with language access, because you have the right to an attorney, but you may not always have access to understand that attorney. Particularly deaf and hard of hearing people struggle to interact with their attorneys and with people within the quote unquote justice system. And so there's an organization called Be Heard that helps disabled, deaf, and hard of hearing people. Also understanding, like, one of the nuances to disability is that English is not a lot of deaf people's first language. ASL is. And so when you ask them to speak in English or write in English, you're actually asking them to write in a second language. So having access to ASL services and translators is incredibly important for their accessibility, as well as their legal recourse.
Well, and I appreciate that as a parent to a kiddo who's hard of hearing, and ASL is a part of our code switching throughout the day, every day. Interaction with law enforcement is a big fear, and we've had to have that talk a couple of times about remaining safe in those interactions when a simple miscommunication can be extremely dangerous.
Yeah. And yeah, several people who are deaf and hard of hearing have had deadly interactions with police. So it is incredibly important that people understand the deaf and hard of hearing community. Yeah, but like I said, Be Heard is an organization that I've donated to before, and they do excellent work making sure that the incarcerated deaf and hard of hearing have access to services. Yeah, but it is very scary.
I am also, our chat has been very active. Dr. Jackson, Paul, thank you so much for all of the links you've been adding into our chat. I'll make sure that we get that posted on Facebook as well, so that folks have access there. And when we do our replay, we'll include that as well in our post, so that you all can check out all of those fantastic resources. I want to thank you so much, Imani, for today. I'm going to listen a couple of times because because you've given us so much to think on, and lots of fantastic direction to move forward in. And your time is so precious, and we appreciate you sharing it with us today. Here at the Cannabis Alliance, we are dedicated to the advancement of a vital, ethical, and sustainable cannabis industry. And it's conversations like these that help get us one step closer to fulfilling our mission statement. So thank you very much.
Thank you so much. And just to let you know, if you would like to read up more on disability and disability justice, the Center for American Progress has a disability justice initiative that talks a lot about intersectionality and some of the challenges facing us today, if you want to be continuing your learning journey.
Thank you.
But I would love to ask a question around specific policy advocacy or specific states where you have seen disability rights contemplated as part of cannabis legalization regulations. Is there anywhere you look to and say they've done this right, or our issues have been addressed or considered as part of the legalization framework?
Yeah, so I was talking to Caitlin about this actually before we started the call.
Oh,
yeah, no, it's even before she started recording, so no worries to you. I think California has kind of done it best, and New York as well. One of the things that is difficult is that the very few organizations that hire disabled people are federally funded. And I was just saying that I work for a disability organization. My boss is really into cannabis. My boss is really into the treatment using cannabis, but we are not allowed to use federal dollars to advocate for cannabis criminalization. Even if we wanted to, we can do it without losing all of our other funding, which goes to like monitoring disabled people in hospitals, making sure that they have equitable treatment and voting things. So like it's kind of like a very much so, our hands are really much so tied in terms of any sort of cannabis advocacy that we do. But there are a lot of people that really want it to go forward. Yeah, but I think decriminalizing, and I forget which state also called for the release of prisoners who were, yeah, I forget which state it was, but that's what I really want, is people to be released from prison. That's like my main goal. I dislike the idea that we are, like I said, we are profiting from something that has incarcerated millions of people.
Yeah.
It's unnecessary, it's inhumane, and it needs to end. Yeah, I hope that answers your question.
No, it helps. And this piece around you can't advocate, or disability organizations can't advocate, but the industry can. We're all part of those conversations, and we just need to be holistic in what we're out there speaking to.
Yeah, and we're actually, I wasn't even allowed to apply for a medical marijuana card, like with my doctor, as somebody whose job is federally funded. So it's even sticky in that way. And I know that there are tons of disabled people who rely on those things, and also disabled people are on benefits, which is also federally funded.
Right.
Yeah, like the disability community is there, they want it to happen, but there's so many different sinkholes that we can misstep into that can force us to lose, healthcare and services.
Yeah, and we ran into that also with more narrowly our veterans and services that they're receiving through the VA, and while in particular for addressing PTSD, cannabis is really an important therapy, and so many of them have to choose between all of their benefits or access to that therapy.
Exactly. And they make it intentionally that difficult, because they know it's an easy key to keep Black and brown people in prison. Like they know it's their easiest tool to use. Yeah, so like I said, the disability community is there. They do very much so want the legalization, decriminalization. But again, a lot of our hands are tied.